This is all over the internet, and you would think that they would never publish this, especially on something like WebMD. But since 2007, this has been well known regarding blood pressure. And that is this: a particular type of chiropractic adjustment can lower your blood pressure. In fact, it is so effective that it's equivalent to taking 2 hypertensive medications. Now, the study, of course, was a small study. It included 50 people. 25 people got an adjustment, and 25 people did not get an adjustment. And of the 25 people that did get an upper cervical adjustment, the systolic, the first number of your blood pressure, went down an average of 14 points. The second number, the diastolic, went down 8 points. And you see, in order to achieve this, you don't need 1 medication, you need 2 medications. Now, I'll put a link down below, but this study was published in the Journal of Human Hypertension. You could look it up on PubMed and various places, but again, I'll put a link. And so the question arises is, they were supposed to do another study, a bigger study, and this has been since 2007. I wonder who's opposed to it. You never know. But the reason the Nucca procedure was done is because it's considered a gentle style of an adjustment that is so gentle that it wouldn't attract much attention, especially on YouTube, because there are super gentle types of adjustments like Nucca, and there are super aggressive adjustments where people are basically putting ropes around people's necks and yanking them across the room. And so those adjustments right there tend to naturally get more hits, which is the reality. And it's more exciting when the person wears a bikini or something like that. But the Nucca adjustment is so gentle that you can actually do a sham adjustment. Now, the interesting thing within the chiropractic profession is this has been going on for a lot longer than 2007. In fact, I primarily use Gonstead adjustments, especially on the upper cervical region. That's the neck up at the top. The atlas, I find that the atlas, you can really rotate people's heads, but it's risky and it scares people. But if you do a side-to-side adjustment that allows the rotation, it's much more gentle. The second thing sometimes I will use is an arthrostim, which can be more, again, on the gentle side, more closer to a Nucca type of adjustment, where the patient actually does feel a very gentle tapping. The problem with a Gonstead adjustment or an arthrostim adjustment is it's very difficult to study because you can't fake it. The patient knows that they're being adjusted or not being adjusted. You can't tell someone, hey, we just adjusted you, and they're like, you never touched me, you know? So it's hard to do studies where you fake it. It's easy to give someone a pill of a drug and then give someone another pill that's sugar pill and study that. So studying chiropractic is a little bit difficult because it's hard to have a group that thinks that they got a treatment, a placebo. The only way to do it would be to have someone not get treatment and another group that gets treatment. But it is fascinating that I've been in practice for 26 years now, and I have had many patients that their blood pressure goes down and their drugs have to be altered for their high blood pressure simply because we start to improve their health. Now, in clinical practice, it's different than a study. In a study, you can only have one variable in order to find out if that variable made a difference. So you can only adjust them. But when you start adjusting a patient, and I've done this many times where you take the blood pressure of a patient, you adjust their upper cervical, you immediately, quickly take their blood pressure again, and the blood pressure drops like a stone. Long term, you also will try to encourage the patient to do some type of deep breathing on a daily basis to reduce stress. You will ask the patient to do some form of exercise like walking. You will try to negotiate a diet in there with the patient, depending on how willing they are to do it. But it is interesting, this study that was done in 2007 was over a period of 8 weeks. So the patients got treatment for 8 weeks. What are your thoughts on this? Have you seen a chiropractor? Have they adjusted your upper cervical spine? Have they taken blood pressure before and after? Have you changed your diet? Have you changed your lifestyle? Blood pressure, despite the fact that in some patients there can be a genetic component to it, is very controllable through natural methods. So let me know what your opinion is. And as always, as every YouTuber ends their story at the end, thumbs up, subscribe, yada, 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 bell, notification. You know, just go ahead and help me out with the algorithm. Thanks for watching, guys. See you next time.